Benefits of using cognitive behavioral therapy with kids and youth. Cognitive behavioral therapy enhances self-control, perceptions of personal efficacy, rational problem-solving skills, social skills, and participation in activities that bring a sense of pleasure or mastery. Children between the ages of 7 to 15 can experience a reduction in anxiety, increased coping skills, and improved emotional awareness and regulation post-CBT treatment. CBT can equip children with the skills needed to understand and cope with their emotions. Children and adolescents who can effectively manage their emotions are 60% less likely to develop mental disorders in later life. Trauma-focused CBT significantly improves symptoms of post-traumatic stress disorder and reduces abuse-related depression, shame, and harmful sexual behaviors in children below the age of 7. Cohen also found that the inclusion of a parent or guardian in TF-CBT led to significantly greater improvements in traumatized children with respect to interpersonal trust and perceived credibility. Group CBT has been shown to improve expressiveness and social skills while decreasing social anxiety and self-reported loneliness in young adults aged 11 to 18 years with autism. CBT can be adapted to allow children who cannot or will not verbalize to express their emotions via other avenues. An examination of school-based CBT programs found improvements in resilience, positive thinking, and increased sense of control, and a reduction in negative self-talk and non-productive coping strategies. CBT may improve moderate to severe anger, irritability, and physical aggression in children and adolescents. During CBT, children can learn how to regulate frustration, improve social problem-solving skills, and role-play assertive behaviors that can be used during conflicts instead of aggression. CBT is flexible and interventions can be adapted to accommodate the developmental stage of the patient in order to treat specific disorders using age-appropriate methods. Cognitive behavioral play therapy can be used in the treatment of selective mutism, anxiety disorders, separation anxiety, sexual abuse, sleep problems, acting out behavior, and the effects of parental divorce in young children. During the CBPT, age-appropriate instruments are used to act out scenarios portraying healthy ways to deal with negative emotions, thus helping children to learn new ways of coping with trauma. Among children experiencing chronic migraines, the use of CBT combined with medication resulted in greater reductions in headache occurrence and migraine-related disability compared with the use of pharmaceutical treatment alone. Sleep in children and teens can be affected by a number of factors, including biological factors, stress, including school and social obligations. CBT has been shown to significantly improve sleep onset latency, instances of waking after sleep onset, total sleep time, and sleep efficiency. CBT for anxiety-related school refusal has shown clinically significant improvements in the attendance of 88% of participants at a small school-refusing study. In a 5-year follow-up, 76% of participants demonstrated normal levels of school attendance and required no additional treatment for school refusal behavior. Cognitive behavioral therapy is as effective a treatment for obsessive-compulsive disorder in children and adolescents as medication alone, decreasing symptoms of childhood OCD over the 12-week program with enduring improvement found at a 9-month follow-up. The disadvantages and problems are a part of adults' everyday life. Parents, friends, school, work, virtually everything can be a source of trouble. Fortunately, we are pretty good at solving many of these problems, but there are some that may seem huge and difficult. They happen quite often. We find them persistent, too complicated to solve, and they affect everything we do. Even though childhood and adolescence are sometimes considered to be periods of careless enjoyment, as many as 20% of children and adolescents have one or more psychological disorders that can be diagnosed. Children are not spared from any day-to-day problems that adults struggle with, although this may seem different to us because there are difficulties in recognizing, processing, and verbalizing those problems due to various factors, including the development stage in which children are. Many of the psychological disorders are pervasive, consuming, and challenging children in all areas: cognitive, emotional, and behavioral. On a personal level, in both children and their parents, there is a chronic feeling of helplessness and suffering in dealing with some of these disorders and problems. Depending on the structure and complexity of the problem, not only parents or guardians, but also other significant figures, psychiatrists, psychotherapists, social worker, teacher, should be engaged in finding a proper strategy that will help the child. Applying the appropriate procedures is of great importance, as it can prevent the development of mental illness. One of them is going through the process of psychotherapy.